Hello, everyone. My name is Steve Krupinski. I'm the marketing director at Michigan Radio. I want to thank you all for joining us. I know there are people still streaming into our event tonight. We appreciate you all joining us. If this is your first time at a Michigan Radio Issues and Ale event, this is a discussion series that Michigan Radio sponsors designed to engage people in conversations about different important issues facing Michigan. Now, normally in pre-COVID times, we would be hosting these events in a brew pub or a bar somewhere across the state. But of course, the way things are, we're all online. And based on how the weather has been today, that may be just as well for most of us. So we are inviting you to sit back with a beverage of your choice and enjoy our discussion. I do want to let you know, since we're doing this as a Zoom webinar, the audience is muted during tonight's event, but we will be taking your questions. We've had several of those that were submitted in advance, but if you have a question, you can submit those during the evening using the Q&A box. So use the Q&A box rather than the chat box, and then we will try to answer as many of those questions as we can. Also want to let you know that we are recording the event and we're also streaming it live on the Michigan Radio Facebook page tonight. Assisting us this evening are members of the Michigan Radio team, including Rusty Brock, who's handling the technical end of our event. And I also want to thank our marketing events producer, Suzanne Bellinger, who's assisted with the event. Before we start, I do want to remind you about a couple other upcoming Michigan Radio events that you might be interested in. First off, coming up in February, you can join the hosts of Michigan Radio's popular Cheers segment, Lester Graham and Tammy Coxon, for an evening of Mardi Gras craft cocktails that's taking place on Fat Tuesday, February 16th at 7 p.m. They're going to share the stories behind some unique New Orleans drinks and walk you through creating those Mardi Gras cocktails in the comfort of your own home. So you can learn more and get tickets for that event if you visit the events page at michiganradio.org. Also, later on in February, Michigan Radio will present an evening with NPR White House correspondent Franco Ordonez. That's on Wednesday, February 24th. He will be joined by Michigan Radio's Zoe Clark in a discussion about the challenges in covering the White House and his observations on reporting on 3 different presidential administrations. So check your inbox, we'll have more information on that coming soon. So events like those and the event that you're participating in tonight are made possible by Michigan Radio donors. If you're a supporter of the station, we thank you for that. And if not, you can always visit support.michiganradio.org and become a member. So our host for tonight's event is April Baer. You know April as the host of Stateside, Michigan Radio's daily talk show that covers news, politics, and culture. And of course, you can hear Stateside each weekday at 3 p.m. and again at 9 p.m. on Michigan Radio. And the show can also be heard on public radio stations all across Michigan. So to tell you more and to start our event, here is April Baer.
Hey, everyone. Thank you for making some time for this tonight. I know everyone is still a little at loose ends in terms of the best use of our most valuable resource, which is, of course, time. I wanted to start tonight with just a brief story about how I spent my week. On Saturday the 16th, I was at home with my husband and my daughter, and it was late afternoon, and I was rejoicing in the fact that for the first time in perhaps 6 months, I was actually going to finish all of our laundry for the weekend. And then the phone rang, and it was my mother, and she said she really needed to see a doctor right away. She has a heart problem that we knew about, but this was the first real episode of its kind that we'd had. I took her to an urgent care, and an ambulance was summoned shortly thereafter. All we do all day at work is talk about this virus. We talk to people who have been dealing with it, people who've lost people they loved, people who have lost capacity of their own, who've lost a chance to work at the work that they've been doing. We've been talking to people in the medical sphere about what this has meant for their work and their lives, and the toll that nonstop grief in 2020 and beyond has taken on their lives. And yet, when the ambulance showed up, I was gathering everything I brought with me, the power bars, the water bottle, the phone charger, all of it, somehow thinking in my head that I was going to be in for a long night at the ER. And then the EMT turned to me, of course, and said, someone from the hospital will contact you. And I was reminded for perhaps the 500th time this year of, of what this is meaning to families all across Michigan. Not being able to be with my mother as she spent a week in the hospital. I'm sure I don't have to explain to folks in this audience who may have loved ones in nursing homes or assisted living or some other congregate care situation. We continue to learn how this virus is changing our lives and how it's changing the stakes for our discussions about healthcare, social welfare, and just how we are with each other, how it's changing politics. The story is, I know I'll get email if I don't say my mother is back home and she has a plan of care. We hope all will be well. But I am right back where I was in the initial weeks of the pandemic, masking, double masking, trying not to touch my face, looking to her care, helping her get around at home in this interim period, and listening to all the stories of vaccinations and hoping that everyone, including my mother, will have a chance at this. Just in case you were wondering, a week's stay at Michigan Medicine with a heart condition at the age of 74 does not guarantee you a vaccine. And that's where my family is right now. We've invited a panel of guests to talk us through some of the very difficult questions that we all have. And I don't know if we're going to have answers for everything you want to know, but Michigan is full of big brains, and we're going to do our best tonight. Our guests are Dr. Arnold Monto, Professor of Epidemiology and Global Health at the University of Michigan. You may also know that he is the acting chair of the FDA's Vaccines and Related Biological Products Advisory Committee, which gave him the unenviable job of chairing seemingly endless hearings for the Pfizer and Moderna vaccines that are now slowly coming to people all over the United States. Dr. Monto, welcome.
Thank you.
We're also privileged to have with us Wayne County's Chief Health Officer, Dr. Muhannad Hamami. He's also a lecturer at the University of Michigan's Dearborn campus in public health and has been overseeing the well-being and we hope the vaccination of all of Wayne County's population. Dr. Hamami, welcome. We're so glad you could take a couple of minutes with us tonight.
Thank you, April. Just a correction. I'm not the Chief Health Officer. I'm the Chief Health Strategist. We do have a very capable, no, that's okay. I used to be the Chief Health Officer in a previous life for Wayne County. This is my second tour of duty. I am back as Chief Health Strategist, specifically helping with the COVID response.
I do beg your pardon, but we're glad you're there just the same. And Robin Erb is here too. She's been helping us quite a lot on stateside, the Michigan Health Watch beat reporter for Bridge, Michigan, and just a fantastic resource on so many different issues around the policy that's been driving all this. Robin, thank you for being here.
Great to be here.
Awesome. Well, team, we've already got quite a lot of questions from the audience, but I just want to start out with some basics that may lay groundwork and help us establish the conversation for the rest of the hour. We will be opening up fully for audience questions in a little bit, but I wanted to start. We got an advanced question from a Michigan radio listener named Ariel, who, bless her, I've had to re-educate myself on this several times through the past 11 months. She writes, I'm having a hard time breaking down and explaining how vaccines work. I have many friends under the impression that the COVID vaccine will stop you from getting COVID once you've been infected with the coronavirus, but that you still spread coronavirus. If that's the case, how does this encourage herd immunity? Dr. Monto, could I bother you one more time to just run us through how the vaccines work, and maybe we can knock out some of Ariel's questions?
Well, we usually don't test a vaccine to show that it stops transmission. I think this is a question which we've only had to deal with this vaccine because we're so committed to trying to reach herd immunity. We know that, for example, flu vaccine, if you prevent flu, in most cases, you don't have asymptomatic infection and continue to have transmission. And why I stress asymptomatic infection, we know that this vaccine prevents 95% of symptomatic disease. And we think it cuts down on asymptomatic infection as well, but that is not something we typically study. But if you have less symptomatic disease, you're almost certainly going to have less asymptomatic infection. And besides that, one of the things that's happening, bad behavior sometimes has good results. And with all the infection that we've been having, we're going to get some degree of immunity in the population increasing by that as well. So summing the vaccination and the infection, we will be able to achieve a level which will, if not stop the outbreak, make it go back to manageable levels.
Right. It's important to keep in mind that a vaccination for COVID-19 will not simply atomize any COVID that comes in contact with your system, but simply tell your immune system what to do once the virus enters your body. Yeah.
Exactly.
My understanding is that Michigan is getting about 60,000 doses of vaccines a week. And I believe that figure applies to both Pfizer and Moderna, but that most of Michigan's doses are Pfizer. Robin Erb, does that sound right to you?
The shipments of the shipments have fluctuated. So for example, and guys, you have to understand, we're looking at this data every day. I'm sure every reporter in the state is looking at this data every day. And yesterday, for example, we noticed there were, I think, 225,000 that got shipped in a 3-day period. But there's also some data lags. There's, it's really tough to tell, but it does, those shipments are fluctuating. And that's a problem for the providers, of course, because they don't know how many shipments or how many doses they'll get. So it creates this stop and start of scheduling. So, we've had, residents, and we've all heard this, these residents are trying to get vaccines. They're trying to get into scheduling portals. They're trying to make calls. They're trying to get an appointment, and they're incredibly frustrated. And that's all because of that unpredictability of a very limited vaccine.
Right. I don't know how much light we can shed on what's happening at the national level and indeed the federal level. And I know things are evolving very quickly, but Dr. Hamami, could you maybe fill us in on what Wayne County understands about who's deciding how many vaccines your county and the others are going to get and how those decisions are being made?
Yes, April, thank you. And just to echo what Robin said, as of at least since we started dealing with the vaccine shipments, and that happened mid-December, the uncertainty was the biggest challenge in how we are moving along. I had a discussion literally yesterday with the Michigan Department of Health and Human Services. As of yesterday, they were still getting 80,000 doses a week of both vaccines. They have been promised to increase that to 120,000 a week, which is still a very minuscule portion of what the demand, and that is for the whole state. So let's now go to Wayne County, which is the most populous in the state of Michigan. Before last shipment that we received a shipment this Monday. Before that, there was a system that you go on they call it the Survey Monkey. It's basically an online ordering tool. And they ask you how many doses do you want? There was a cap on the Pfizer doses that you get in increments of 975. The largest amount that you can request every week was 4,875. And every week we go and enter the maximum amount. And that happens, the deadline is on Thursday. So that happens on Thursday. We do not get a confirmation of the amount we're getting until Monday. So you can imagine if we're planning ahead of time, let's say I want to plan to vaccinate a certain number of people on the following week, then I really don't know how many I have until Monday. And every time we would order the maximum amount, we got, the first shipment was 1950, the second shipment was 975, the third shipment was 2925, and so forth. So there is no pattern whatsoever. And then at sometime in January, I think the first week of January, we did not receive any Pfizer, and all of a sudden we got 5,500 doses of Moderna, which was great. But again, it's how do you put a whole structure of resources and people and mobilize between groups and priority groups and all that with this uncertainty. Fortunately, we were told yesterday that there is now a new methodology where there is no longer the idea that you go and request. So there is now an allocation process. So that Survey Monkey to request your first doses is no longer there, but you are now allocated by the state, the Michigan Department of Health and Human Services, a fixed amount. What I love about this, not that I'm happy with the amount that we're getting, but what I love about this is that even if you tell me I'm getting 100 doses every week and I'm getting 100 doses every week, then I plan to vaccinate 100 people. So we were told that this number should not change. Although the formula and how the concept behind it was to have a more equitable distribution. The formula takes into consideration certain things such as population over 65, essential population, and something that is called the social vulnerability index, which now is a factor to how to spread the vaccine that is coming from the federal government. Now, this is great, but let's again take the example. You have a very small pie and everyone wants the biggest piece. And now it is your responsibility to split that pie in some way that accommodate the appetite of those that want that slice. And this is, I think, the most challenging part for the state that is still receiving 80,000 or even 120,000, where my demand every week is at least 60,000. So you can see where that mismatch is going to happen.
I do not envy what Wayne County and other counties are having to decide right now. Indeed, we had an interview just today on stateside with someone who works for the LMAS Health Department, which is a collection of counties in the eastern part of the Upper Peninsula. Their hospitals received no vaccines last week as a result of the rebalancing. I know this is just a very frustrating time, whether you have hundreds of thousands of people or several thousand. I wanted to ask Arnold Monto, as someone who has been through a number of different epidemics and has looked at this process in many parts of the world, how would you grade our progress in Michigan with vaccine distribution so far?
Well, I would probably be giving it a D, but it's not something that is a D because of bad performance in terms of the state. It's an overall D in terms of how we have been doing, having not anticipated how difficult manufacturing and distribution would be. The emphasis and the spending, and there was a lot of money spent on the program in the federal government, but the money has been spent there and not on distribution or manufacturing that much. It was a public-private partnership, and a lot was dependent on the manufacturing side. Moderna is a small, relatively small, inexperienced company. Pfizer is a giant international company. Pfizer has all sorts of global obligations, and therefore we get part of the Pfizer production, we get a fair amount of the Moderna production, but they can only produce so much. And most of our problems would go away if we had more vaccine. And I really don't understand why this was not recognized a few weeks ago when all I was hearing was we need, the equivalent of a Peace Corps or whatever to deliver vaccine. What are they going to deliver if there isn't more production?
Robin Erb, could you maybe, you've talked to people in several cities about, what how the vaccine rollout is going. What are some of your observations about how this has gone?
Badly.
Yeah.
And it's kind of what I mentioned before. And I get it. It's, as a reporter, you want to figure out what the problem is, what caused this, but there really is no bad actor here, not a single bad actor, a single bad program. It's a lot of great intention and a very small supply for a very big need. And, again, at the receiving end, if you're the one just trying to get your vaccine and you're in that group and you're eligible, but you can't get anyone on the phone, you can't get through to the website, you feel like it's not working. And arguably it's not.
Right. Mohanad Hamami, I wonder, could you maybe tell us, like, if we were to talk about the basic barriers to moving this along faster? There is the issue of availability, but what other challenges has Wayne County had to deal with to try to get these out in an efficient manner?
The biggest challenge is certainly the whether the supply is meeting the demand. So the availability of the vaccine, what we talked about, the unpredictability, how much you're getting versus how much you're expecting, and trying to whip a plan based on what you're getting. That, I would say, is the biggest challenge. We do not have, as of now, fortunately, we do not have a capacity issue. I would love to have a capacity issue. I would love to have 100,000 doses where I need more people, and we have a plan in place to do that. Right now, our capacity is, I wouldn't say it is at maximum. It's good. We can manage what we're getting. We can manage more of what we're getting. There is also some of, on a lesser scale, there is this notion of resistance or reluctance where people are not going to take the vaccine. I tell everybody that when it's your turn, you need to take it, because you don't know when your turn can come back again when you change your mind. On average, we have dealt with all the priority groups. So we have done the emergency medical services, we have done the long-term care facilities, and now we're at priority group 3 of group 1A. These are the necessary healthcare. Within these 3 groups, on average, we are seeing a willingness to be vaccinated that is close to 60%. I would expect those that are in the health field, those that understand the vaccine, how it works and the importance of it and all that, I would have expected at least 70, if not more. We are working on that in terms of, public awareness and education and all that. There are a lot of misinformation. There are a lot of misfacts that are circulating. Unfortunately, this pandemic from the beginning, with now the vaccine, have been politicized, and this is adding to the challenge of where you sit, on which side you are, and what your attitude is, whether it's towards wearing a mask or towards accepting a vaccine. And these are some of the challenges we're dealing with. But I would say the biggest challenge is definitely the quantity and the frequency. And if that is resolved, then I think we will see a tip towards people getting vaccinated.
If you're just joining us, our guests tonight are Dr. Mohanad Hamami. He's the Chief Health Strategist for Wayne County and has been directing efforts to get the COVID vaccine out to as many people as possible. He's also a lecturer at the University of Michigan's Dearborn campus. We're also talking with Robin Erb, a reporter for Bridge, Michigan and Michigan Health Watch, and Dr. Arnold Monto, professor of epidemiology and global health at the University of Michigan. I want to talk more about resistance, but I would also like to take some questions. And the very first person to send in an advanced question is Diane in Flint. So Diane, you win. We're definitely getting to this. And hers isn't so much a question as a request that we inform people what to expect if they go for vaccination at a drive-through site. Dr. Hamami, is Wayne County doing any drive-throughs?
Absolutely, we are. Yes.
Do you want to talk a little bit about what people should do if they can get an appointment and they are ready to go?
I will be more than happy. Diane, if you happen to visit Wayne County and you are going to be scheduled an appointment to do a drive-through. We currently have 2 locations. We have a walk-in and we have a drive-through, but I will specifically talk about the drive-through. There will be, of course, we are experiencing lines of cars. So you are still in your car, you are still warm, and we don't want you to turn off your engine or whatever because you're still outside. The first step is you are going to be greeted by a greeter, and it is just to check that you are supposed to be here. So again, we talk about the groups that are scheduled. We talk about the priorities. We certainly don't want you to be taking somebody else's turn. So if you belong to, let's say, an EMS or the essential healthcare or teachers, as we're moving to phase 1B very soon, then this is what the greeter is going to do to make sure that you are here because you need to be here. Once you are at the line towards going to get your vaccine, you are asked to fill a form with some basic information. There is a pre-screening form that checks on your history, whether you have allergies, whether you have any health conditions. And as you're moving along, you get to, we currently are using our garage at the health department. It has 2 lanes. It can accommodate 3 cars in a row. And this is where our nurses are with the vaccine. So we can do 3 cars in one every batch. So the nurse is going to screen that questionnaire that you filled. She's going to ask you more questions if there is any need. And then we always tell those that are coming through to wear a short sleeve under their coat. They just expose their shoulder. They are given the vaccine. And then they're given a card with their next appointment. They're given information how to register for the VSafe program, which I encourage everybody that gets the vaccine to download that app and make sure they answer it, because when people talk about side effects, this is the best tool to find out what is happening. So far, we have vaccinated 20 million people, and this is the richest data of follow-up that you can have on people if everybody is answering these questions. Once you are vaccinated, we ask you to go to another hold area that we call the observation area. You are still in your car. You remain there for 15 minutes. We instruct our people that got vaccinated that if they feel anything funny, whatever it is, to honk their horn, and immediately someone is going to go and ask them what's happening and tend to whatever we believe needs to be done.
So leave your door. So leave your car door unlocked.
Yes, yes.
Yeah.
It's very, very smooth. The whole process from the minute you get to the nurse until you get out doesn't take more than 4 minutes.
That's amazing. Let's go to another question. I think this is a good one for Dr. Arnold Monto. Adam wants to know what may be causing delays with the FDA's approval of the Oxford Astrazeneca vaccine?
Well, FDA responds to submissions from the companies. AstraZeneca has not applied for approval in the United States yet. And we can speculate about the reasons. And some of them have to do with the submission that they had in the UK. And there are both trials going on in the UK and the US. And there were some issues about not using the appropriate dose and duration between the doses, and questions that were related to how efficacy was affected by this. We can only speculate on the basis of what is publicly available, and what is publicly available is based on the fact that there probably will not be a submission in the US until maybe March or April. And that's what is publicly available. What is also publicly available is that the Johnson & Johnson 1-dose vaccine will probably be submitted to the FDA within the next week or so, which probably means we will have another advisory meeting about 2 weeks after that. They submit to the FDA. The FDA lets us know on the committee privately at first, and then it becomes public, the submission material from the companies. During that period, they do their own analysis of the raw data that are submitted to them. And then 2 days before the meeting, that all becomes public. And then the meeting takes place in front of everybody on YouTube. And then you can all watch how we have to sit in place for 8 or 9 hours while the discussion goes on and we have a vote. Then, since we're only advisory, then they take what we say and actually take the action the next day or two after we finish our meeting. So that's the schedule that follows.
Another job I'm glad I don't have to pick up in addition to all this.
And I can tell you, we've had between 18 and 22 members of the committee.
That's
April, I was just going to say during the last meeting, this is how long those meetings are. I ordered out both my lunch and then later my dinner, and the meeting was still going on. So
ouch.
I was part of the YouTube.
And then we got criticism for not having the meeting go on for 2 days. And this is while the White House was breathing down FDA's neck to approve.
Oh, wow. There's a question here about the logistics of vaccine appointments that, Robin, I wonder if you would have any thoughts about this. This is Steve, who he has a kind of a long email. I'm gonna have to paraphrase a bit, but he says, I'm on waiting lists with 3 different hospitals, 1 pharmacy chain and 1 university, and I'm looking for more waiting lists to join. He also says, I know someone with 7 different appointments, each at a different place, and she won't surrender any until she's actually been vaccinated. Steve is looking longingly a few states over to West Virginia, which has been a little bit more efficient in getting its population, in getting needles into arms. And he asks, is there any solution other than moving to West Virginia? Robin, when you look at this,
like a drastic solution.
I know,
The
right?
solution is
Although
more
it's beautiful there.
vaccine.
Yeah, more vaccine. Thank you. You know, the system that we have, and I wonder, maybe Dr. Hamami would have some thoughts on this as well, but the system that we have seems to put, I mean, there's a great amount of onus on having this relationship with a clinic or a hospital or a primary care doctor for those who are in line for it. I know that we're just starting to see the onset of some schools within the next 3 weeks or so starting to offer vaccinations for their folks. But I mean, Robin, what kind of talk have you heard about another way to do this?
I hate to tell you, in many ways, this is like the testing too. Remember when testing gets really backed up?
Yes.
Everybody panics. And I don't mean that badly. I mean, I understand where it comes from. And you're making appointments at different testing to get testing. And then you're trying to get, it's whoever gives you the results back first. And the problem is, of course, then you have longer waiting lines because everybody has multiple appointments. I don't know what the answer is. In fact, Linda Vail, who's the Ingham County health officer, addressed this today, in fact. And she said, and I was surprised, she said, do it. Make multiple appointments. But once you have the vaccine, yes, cancel all the other appointments. Make sure you don't clog up the system for other people. Now, I don't know if I'd really make 12 appointments, but I do understand trying to do that. Now, the state tells me today, and if there is fault, I mean, maybe it seems like there should be one clearinghouse for all of these disparate providers, health departments, the Meijer store, the pharmacies. The state does tell me they're trying to put all of this in one place, because right now there's not even one place on the state website to find this. You can find the health departments, but they don't tell you about Meijers right now. They don't tell you about your local pharmacist. And one more point, part of the problem is that also varies by location. Your local pharmacist in one county may give you the vaccine. but maybe it's the hospital in another county.
Right.
So once again, it's kind of a free for all, and people are, as you say, you kind of have to have that relationship or the ability to internet search for that relationship or that entry into the scheduling.
Dr. Hamami, how do you begin to give people the information they need to navigate this?
It's funny, April, as you mentioned this and Robin is talking. It reminds me of my young days when before there was online Ticketmaster. We used to go to Hudson to get tickets for concerts, and I remember going there like at midnight waiting for Van Halen to get tickets and to see Monsters of Rock, which was like the big deal. Now with the internet, a bunch of us would all go, and as Robin said, we overwhelm the system. Everyone is staying in line and doing that. So Steve, I don't know if you're part of the solution or part of the problem in doing that. But on a more serious note, it is not, it's unfortunately, we know that there are so many successful models that are out there, and we're looking at them and we're trying to see the applicability. But it is not one size fits all, because, no pun intended, the size does matter in this case. We have, let's take Michigan, for example. I get a lot of emails and calls and say, well, such and such county have moved to phase 1C, such and such county are doing the teachers. And that is great, but it is different when you have a county that has 1.2 million versus a county that have maybe 10,000 or 5,000. So things are better managed. I watched yesterday, I think it was the governor of Virginia or West Virginia talking about why this is successful, because it was manageable, because everybody knew everybody, they had a great relationship, they had a great network, they put a system, it worked. I'm not saying this cannot work elsewhere, but we need to also understand that with scalability, there are so many things that have to be factored in. And then add to it the major thing, as Arnold mentioned, more vaccines. The best system that you have, the best tool, online scheduling, immediately you get an appointment. But how can you get an immediate appointment if you don't know if there are vaccines? It will make no sense to give you an appointment tomorrow to come and tell you, well, I'm sorry, I don't have vaccine for you. Go back online, schedule for next week. So this is where the delay is happening. There is high demand. There is, at the first time, Beaumont Health, one of our partners in Wayne County, announced that they are accepting 65 and older, their website crashed immediately within the first half an hour, because everybody was flooding that. Now, unfortunately, they have to control how that is happening. I think I saw somewhere in the Q&A that there are people that cannot get through a phone, they cannot get through an email. You mentioned Meyer, that is now a newcomer into vaccinating the 65 and older. We had a call with Myers, and we told them, okay, are you doing anything in Wayne County? And they said, yeah, we have several locations in Wayne County, but we're not going to tell you where they are, because we don't want people coming unannounced. We are going to still have our national link to request an appointment, and it will be filtered, and we will answer those that are coming. So there is this, as Robin said, there is this much desire to be the first in line that is also adding to the system failing. And I think the key is patience. And I've never used this word that I have used it in the past 2 weeks. Patience is the key on everybody's side. Those of us that are not getting vaccine, those that are not getting appointments, those that are not getting answers, patience is truly what we want to experience now and practice.
I'd like to read a couple of emails back to back. One of them came in before a couple of days ago, and one of them is from a participant named Hillary, who is with us tonight. Hillary writes, I'm a full-time high school teacher and have been in person since August. I've been wearing N95 masks, but have been nervous every day at school. Students don't wear masks properly, don't social distance very well. I'm 48 years old and am told I shouldn't expect any vaccine for a couple of months. Why am I so low on the totem pole? Also, my son works at Pfizer. I know there is no shortage of vaccines. They're being churned out just 2 hours drive to my west. Okay, now hold on to that and listen to this. We got an email from a listener named Rick who says, I'm a 58-year-old man who works at a big box store and have been working 45 plus hours a week all year. I've been surrounded by 1,000 plus people all day, all year, socially distanced as best we could. And he goes on to point out that teachers' unions, in his words, dug their heels in about not resuming school until their members get vaccinated. He's not happy that teachers are now part of the priority list when he and the people he works with will wait longer. Panel, I just wanted to ask, I mean, in a time of such scarcity of vaccines, we're very lucky that Pfizer is in Michigan, but Michigan's not getting enough. That's a fact. Was it inevitable that in a time of this kind of scarcity, the groups in line for doses would have this feeling of being pitted against each other? This is just one example of many, many different conversations that I've heard, saying, well, nursing home residents, police officers, just this feels like an impossible piece of math that we're trying to do.
There is no right answer. And you can prioritize, as CDC did, in the best way they knew how, based on risk groups, but they came up with approaches which were immediately thrown out. For example, they prioritized the 75 and above before the 65 and above, which means that there's less prioritization in the older group. And they did it, or I think that many states did it because of feasibility. I am really worried about opening to those with underlying conditions. Who defines underlying conditions? I don't think it's something that is workable. In the flu field, which I know very well, we threw out underlying conditions and just went on an age basis before we made the recommendation universal, because nobody could ever figure out the recommendations. This is all what we're learning is our fragmented healthcare system in the United States doesn't deal with prevention very well, which we knew going in. And I hope we remember that when we come out of all this, which I think we will at some time. Pandemics and epidemics do end.
One of the things that is frustrating too is, you have folks who are in this priority group and then they hear of somebody who heard of somebody, and I think that's very legitimate. You have somebody who may have been part of a health system, for example, but they're working at home, or they don't have to work with, there are all these different stories of people who might have been in the group in front of me, but they're really not as much risk. And it's, I get it. I've been talking to a lot of folks who haven't seen their loved ones in nursing homes for 10 months. And they say, give me a vaccine so I can go hug my mother. I haven't seen her for 10 months. It's a legitimate request. So I've said it several times too. They're just impossible decisions this year.
Well, one of my very close colleagues is actually on the ACIP, and she was the one who was against giving vaccine to nursing home residents for two reasons. She said they don't respond all that well as independently living adults, which I don't really buy, because I think a lot of them do. But the other thing she said, and we're seeing this now in the press, is that nursing home residents die of other things. And as soon as we start mass vaccinating nursing homes, they're going to say the vaccine is killing people. And we're seeing that right now.
Right. And unfortunately, April, to your point, we have been, this pandemic has exposed a lot of the shortcomings of our public health and preventative system. If you remember, early in the pandemic, we used rationing in who can get a ventilator. That was even more serious than who gets a vaccine.
Mhm.
By who gets a ventilator, you are deciding who is living and who is going to die. And that is such a hard thing to do, but it was because we were never prepared for something this massive. Now that we are dealing with, again, the scarcity of vaccines, then unfortunately we are forced to use rationing. Back to Hillary's question, why are teachers on that lower level? Fortunately, teachers are no longer on that. And by January 6th, when the governor went and said they should be moved as the priorities in Group 1B, then immediately they were as essential as law enforcement. And this is how we're dealing with them. But unfortunately, again, that opened the door. In Wayne County, I have 20,000 teachers. In order to do the 20,000 teachers, in addition to the 18,000 necessary healthcare in priority 3 and the 3,000 police officers, then immediately I have the pie that I need to slice again.
Yeah.
So the issue with Pfizer, and I don't know if Arnold probably have better information than I do, but my understanding is that at some point when all those vaccines were going through phase 3 trial, someone, I think it was a wise move, but it wasn't such a wise move after all, decided not to put all our eggs in one basket. And they bought a specific amount of Pfizer, specific amount of Moderna, and then they also bought the Astrazeneca, the Johnson & Johnson, and the others. So as a supplier, I am Pfizer. I have 500 million doses. You only bought 100 million from me. I'm going to sell the rest to Europe. So now that it is approved, please, Pfizer, give me more. Well, I'm sorry, I sold it. Wait until I make the next batch. And this is what we're dealing with. We are getting more, but it's not coming anytime soon. So this is, again, the supply and demand.
We have a question that came in from Tim, who's with us tonight, that I think this is something that's been perplexing a lot of people. He writes, I keep hearing news that those giving out doses of the vaccine don't have enough, but that there also may be at any given week, maybe 50% of the doses sitting in freezers. Can we explain the statistical disconnect that we sometimes hear in the reporting of the numbers? Robin or Mohana, do either of you want to field this one?
I can start, and then you can offer some details and tell me if I've got any of this messed up. How's that?
Will do.
So there is the state, to the credit of the state, they put a ton of data out there, and it's all accessible to the public. So if you look at the number of doses that are shipped, and shipped is the word they use, if you look at the number of doses that are shipped and then administered, it looks terrible. At one point last week, we've been doing a terrible job if you look at the numbers. Now, the data though, shipped means en route. So some of those doses haven't even landed here. Also, some of those folks may be scheduled to get those doses. They're just not in the arms yet. So you may look at a county and say, hey, they've got 500 doses sitting there. But what the county has is 2 days of 500 appointments those doses they don't really have somebody's name on them, but they are scheduled for an arm. So the data is really tricky. It's not to say the data is great. We're having a lot of trouble, tracking it ourselves, but there are some explanations for those big disconnects.
Yeah. Mohana, does that track?
That certainly is one part of it. The second part is for whoever is using the state dashboard, there is a dashboard on the state that have a tab that says doses shipped, and you can look at a heat map per county, and there are doses administered. This data comes from MICR, which is the Michigan Registry for Immunizations. We put everything from childhood immunizations to this immunization data. The data of vaccines administered follow your address, so your residence address. So let's say you got your dose in Wayne County, but you live in Oakland County, then doses administered are now accredited to Oakland County, and it's not registered in Wayne County. So if you look, let's take the city of Detroit as an example, and I hate to choose the city of Detroit. The city of Detroit, in heat map shows you that they received 50,000 doses. But if you click on the next tab that it tells you how many administered, it would show you 5,000, which absolutely makes no sense. But let's take the 4 major hospitals that are in the city of Detroit, where most of those staff members and physicians live outside of the city of Detroit. Those were all vaccinated in the city, but they are entered in MICR as residents of Oakland County and Wayne County and Macomb County and others. And this explains that mismatch. To Tim's point, maybe very early on, there was this period where we were still guessing, should we save the second dose or not? Should we be more conservative because we want the second dose? But until we got the assurances from everybody that the second dose is coming and go ahead and exhaust everything, I can assure you that if you are looking at any inventory across health systems and health departments, you will not find that high number of vaccines sitting in freezers. I wish we can find those, because then we can redistribute and we can share.
Yeah. This is a question, Arnold, I think this one's is for you. The listener says, why can't the federal government enable third parties to manufacture vaccine, so we're not just relying on 2 companies, Pfizer and Moderna? I'm guessing that this has something to, that although it was a public-private partnership that gave us all the different research tracks for the vaccines, I'm guessing the terms of those deals were, if you come up with a winner, you're the one who gets to make it.
It's more simple than that. Manufacturing vaccines, they are biologics. They are difficult to manufacture. It's not like manufacturing drugs, which are not easy either, but much less complicated. When we used to prepare for pandemics, which occurred in the 2004s, 2005s, under, in fact, the Bush administration, there was talk and actual spending, I think, on developing modular plants for vaccine production. You really have to anticipate how to manufacture vaccines. It may be possible. For example, Merck just said that their trials failed. They've got manufacturing facilities that something could be worked out, but we live in a private, in a capitalist society. And even though all of the manufacturers except Pfizer did get federal money for their development, Pfizer got assurance of a market, and that's where their $1 billion went. But nobody really worked on any of the downstream. Warp speed was basically vaccine development. And also buying, beginning lots of vaccine. But each of these companies has an obligation to FDA to validate, to standardize each lot that they produce. It's not like producing chicken soup. It's very, very complicated. And there are a lot of safety standards that have to be adhered to. So you can't turn it on. And when they start talking about increasing supply, I heard just this evening on one of the news programs, they're talking this summer.
Oh boy.
It's very depressing when you think come right down to it. There are a few countries that have been able to move ahead. They are basically like West Virginia, small, so that they have not too many to vaccinate, and they've been successful. They also have standard healthcare systems where they can identify, where they know how to deliver vaccines, and they know who is at risk because they have standard medical care. They're in medical care. They've got their records. They know they don't have to worry about who's above age 65. They know.
It's crazy.
And they don't have to, you don't have to fill in a form because they know.
We would be remiss if we didn't take a moment to note that there's a variant on the loose in Michigan, B117, that has reared its head in Washtenaw and Wayne, and I believe a couple of other counties as well. Can I just take a moment? I feel like we really do need to take a moment and talk about best practices for dodging this latest wave of the virus. I mean, is it enough to say, Mohamed and Arnold, just keep doing what you're doing?
That's all we can say right now. My colleague, Emily Martin, is trying valiantly to keep everything bottled up in Washtenaw, especially on the Michigan campus, which is where the B117 reared its head. And she says it is a easy transmitter. Small, casual contact without a mask transmits with this virus, with this variant. But the same things will inhibit the spread, same mitigation strategies. And I would be careful before I assume that this produces more severe disease. It's very hard to define severity. And I think if we can stop the infection by doing what we've been doing, then we won't have to worry about severity.
Mohamed, anything to add?
Agree. Yeah, I absolutely agree with Arnold. Whatever common sense that we've been using, and we know that it's been effective, wearing a mask, physical distancing, and hygiene is going to work. It is important for people to know, and it is human nature that we always fear what we do not know. It is important that we understand that any virus, no matter what it is, even the flu virus that we have been living with for ages, it is part of the evolution that it goes into those mutations, and this is what produces variants. It goes into 1,000 mutations per year, and this is normal. As Arnold said, some concern become when they are changing the characteristics of the virus or the original virus. In this case, the B117 is more spreadable. Again, there hasn't been any documentation or any confirmation that it makes it more virulent. That means if you get it versus the original virus, you have a more severe infection. The vaccine has so far been proven that it can still attack the new variant as well. So maintain your prevention and preventive measures. Make sure that if you are eligible and you can get the vaccine, you get the vaccine, and continue to practice masking, distancing, and hygiene. This is the best remedy for anything that we are going to see coming out of this virus.
I have one last question that is open to really anyone who has thoughts on it. Have you ever stood on a beach at a place where several currents are sort of breaking over the shore at once? It's a very strange feeling, and it really mirrors the way I've been feeling at several phases of the epidemic, but especially now. The state is making a full court press on vaccination, and people are getting scheduled for appointments. People are getting vaccinated, albeit slowly. And at the same time, the restaurants are opening. And there's a more readily distributed strain of the vaccination, a strain of the virus making the rounds. Does it feel like our strategies are at cross purpose at a time when Michigan has made another success at driving our case rates down? It's just very hard. It's very hard to feel a true sense of progress with all these different currents breaking over us at once. Arnold,
Yeah,
yeah.
it's very difficult at this point. People have people's patience. We can say be patient, but people
Drink,
by nature
everybody,
are not,
drink.
are impatient. And that's one of the reasons why, if they have been behaving and doing what they should be doing, they like to see that there is progress. And it is very difficult to try to manage human behavior as if you're working in the laboratory and just turning a spigot on and off. And I think we in the state of Michigan have been doing it as well as any other place in the country. We've managed not to have the surge that we had, unfortunately, in Detroit early. We've been close a couple of times, and that is the key. We can't overwhelm the healthcare system. We can't put healthcare workers in the position of having to make impossible decisions about who gets on a ventilator and who does not. And we've managed that. And we just have to do that going forward.
Robin, you recently wrote a really evocative piece about what covering the first year of the pandemic was like. How often do you feel like it's not one step forward, 2 steps back, but like 3 steps sideways, and then 5 steps forward, and then 8 steps back, and then 2 steps the other side, and it's like a bad dance class.
Say it again. I mean, I've said it so many times. I think my favorite, not my favorite, but the 2 words I keep repeating are impossible decisions.
Yeah.
And it does feel like you're getting dragged in all ways, but you know, it's easy to say we've got to get this under control, shut everything down. And you've got people saying, you might be keeping me alive. You're killing my business. You're killing my ability to support my family. You know, my kids, school, you know, there are just so many pieces of this. And again, everybody's well-intentioned. It's just really, really tough. And I think I'll say patience again too, not necessarily with the vaccine today, but right now, but just in terms of understanding each other and trying to understand each other's perspective. And it's easy, especially with this last year that's behind us, to say they're wrong, we're right, whatever, in whatever argument. But I think there needs to be some patience and some listening to what other people are saying that don't necessarily agree with us. And there are a lot of real big intentions here.
Mohamed, how do you juggle all these conflicting currents?
I have to say, April, I love your analogy of the beach. It is something that I wish we can all be around sipping a drink. I do completely agree with Arnold and Robin. I think it is something that, again, it's human nature that we want this to be over. We are so tired. We want to go back to normal, whatever that normal is. I am not saying that we should be secluded and we should not open up and all that. But when we do it, we have to maintain some reason and we need to be responsible. I remember when we were talking about during the Thanksgiving or during Christmas, how hard it was to celebrate those holidays alone or to restrict your social gathering to the immediate family. We all want grandma and grandpa to be there, but it is also our responsibility to protect grandma and grandpa. And I think this is what we need to keep in our minds, that we are not only doing this, we cannot be selfish to say, well, I'm tired of not going to a bar and enjoying a drink with friends. I'm tired not going out and seeing people, but I might be invincible because I'm young and I have a good health. But what am I bringing back to those that I love the most and might be exposing them? And again, the key is responsibility, and how can we do that? I think we have, as Arnold said, we have dodged the bullet in Michigan several times. The trend that we are seeing now after this closure during the holidays is very positive. I hope that come February 1st, and we are opening up, that again, we open up responsibly, and that is prudent on us as citizens to practice, again, common sense and responsibility, rather than to say, well, I'm done. I've been cooped up for 6 months, and now it's my time to go and go wild and do all kind of things.
Like that responsibility is just as important as the patient's part.
I think this is going to be one of those stories, and I've worked on a few of them in my time, where you're not going to really get a full sense of good feeling out of it. But I always take comfort in talking to smart people about this stuff and people who are doing everything they can. And so I really want to thank all three of you: Robin Erb from Bridge, Michigan, Dr. Arnold Monto, Professor of Epidemiology at the University of Michigan, and our Chief Health Strategist for Wayne County, Dr. Mohanad Hamami. All three of you, I just can't say thanks enough for everything that you're doing. And good Lord, for making time to talk to us amidst the Omni crisis.
It's a pleasure. Thank you
So much. It's been great.
And
Yeah.
everyone, I
Nice
just want to
talking.
I just want to say to everyone who's joined us tonight, I'm so sorry we couldn't get to all your questions. More questions than answers every single day of this crisis. But we really value you. We value the fact that you shared some things from your life with all this. I want to thank Rusty Brack and Suzanne Bellinger and Steve Krupinski, everybody who made this possible, and my amazing stateside team. They are just the best. Please take care of each other and take care of yourself. Please don't forget to do that too. We'll see you at the next Issues in Ale from Mardi Gras. And until then, raise a glass.
Cheers.